COVID hospitalizations for children have reached a record high in Chicago. The city is currently seeing a daily average of about 7 hospitalizations. And despite these numbers, some data suggests that the Omicron variant is causing a milder illness in children. Joining us with more is Dr. Taylor Heald-Sargent, a pediatric infectious disease physician at Lurie Children's Hospital. Welcome back, Dr. Sargent, and thank you for joining us again. So first off tonight, we had last night Chicago Department of Public Health Commissioner Dr. Allison Arwady on the show, and she spoke about the spike in hospitalizations. Here she is.
Even before vaccines were available, the rate, thank goodness, that we are seeing children hospitalized with COVID is very similar to the rate that we see children hospitalized with flu in a typical year.
Would you say, Dr. Heald-Sargent, that you're seeing the same pattern at Lurie?
I can't speak to the number of flu since we haven't had that in several years to the same degree as we've had COVID, but I can say over the past 2 weeks here, we've had over 110 patients be admitted with COVID-19 to our institution, and about 20% of them had needed ICU level care. So it's not an insignificant amount of children. It's the most we've had since the pandemic started.
The most you've had since the pandemic started. In that same interview with Dr. Arwady, she did say while the numbers are rising for children, it is still rare. But from what we're hearing, 110 admissions in the last 2 weeks, that sounds like a lot. How would you put that into context for us?
So it is a lot. And although everyone keeps talking about how Omicron is slightly milder, it appears, and overall COVID is milder in children, when you have large numbers of infected individuals, the rare events are going to occur, and those rare events are hospitalization and severe illness. So it has been pretty high amounts recently for us.
Okay. As you just said, Omicron said to be milder in children, but we are seeing these climbing, infection and hospitalization rates for children. Is it a matter of, comorbidities and, other health issues that are putting these children in your care?
Certainly that's some of them. Also, you have to remember that a large proportion of our children are unvaccinated, not because of choice, but because they don't have access to vaccines, be that through their parents' decisions or because they're less than 5 years old. Over half of our patients that have been admitted recently have been less than 5 and unable to get vaccinated because there's just not a vaccine for that age group. Some of them certainly do have other comorbidities, but some have been otherwise healthy.
What would you say is, we've heard, reports from some hospitals as well, children's hospitals across the country, that children are being admitted for other illnesses and testing positive, at the point of admission and having been otherwise asymptomatic. Are you experiencing that as well?
We've seen that in about 25% of our cases, that children might present for other reasons and are found to be COVID positive or admitted for reasons that thought not to be related to COVID. But still, the vast majority that are coming in positive are being admitted for COVID-19.
Okay. Are there symptoms that parents of young children should be looking out for?
So the things that people have been watching in general, a cold that progresses into a cough, seeming like they're having difficulty breathing. For young children, that can be hard to figure out because they can't always tell you if it's hard for them to breathe. So watching to see if they're breathing faster than normal. If it seems like they're working harder, you can see some tugging at their muscles in their chest or their neck. If they're sleepier than usual, or if they're having trouble keeping down fluids. So sometimes the GI, the gastrointestinal, so vomiting and diarrhea can be a component of this, and just keeping kids hydrated can be a challenge.
Would you say, are you seeing a difference between how the Delta variant affected children compared to Omicron?
So luckily, we didn't have the same spike up in this region with Delta that was seen in the other regions. And so our Delta infections were manageable in that there were lower number. Here, I would say, although we are seeing a lot of respiratory illnesses, it's similar in presentation to Delta.
What impact would you say, this increase in patients up to 110 over those 2 weeks, how is that impacting your resources there, your staff, and your ability? Obviously, you're a children's hospital, so you're designed for it, but that's a large influx of children.
Yes, and we are designed for it. This is something that we expect in the winter time, is our busy time with respiratory viruses and with flu, as Dr. already said. It's not unheard of for us to have issues, but the problem that is compounded here and other hospitals is, number one, that we're all weary. And so adding to already pandemic weariness and fatigue, and then that our staffing is actually affected by the pandemic. So we're not alone in the fact that we're having issues with staffing. And so it's not just the number of beds and the number of patients, but it's the number of care providers that have. Luckily, we're able to keep on top of things, and our staff, our infection prevention and control has ensured that we have enough personal protective equipment and masks to go around, but it's tiring.
Doctor, obviously, all day, a lot of us have been talking about the argument between the Chicago Public School District as well as CTU about children returning to their classrooms. Do you have any concerns about children being back in the classroom affecting the number of patients that you see there?
I think in general, we just have to remember that we need to keep up all of our mitigation efforts as best we can. Vaccination, testing, masking, good ventilation, those all need to be in place to keep the rates as low as we can get them. Sometimes schools are able to provide those. And I think that that's the main factor, is that if schools are providing those mitigation factors and kids are in those relatively safe environments, then it can be done well and it might not impact our rates as much.
Okay, we'll have to leave it there. Dr. Taylor Heald Sargent, thanks for the work that you do and for joining us.
Thank you.